Welcome to tonight's webinar. My name is Laurie O'Brien, Director of Programs for CAN-DO Multiple Sclerosis. Thank you for acting on the belief that you are more than your MS by attending tonight's webinar, Aging with MS, presented by Gail Hartley, Registered Nurse, and Terry DiLorenzo, Health Psychologist. CAN-DO MS is an innovative provider of lifestyle empowerment programs for people living with MS and their support partners. We empower people to move beyond their MS by giving them the knowledge, skills, tools, and confidence to adopt healthy lifestyle behaviors, actively co-manage their disease, and live their best lives. Please visit the CAN-DO MS website at www.mscando.org, where you can register for upcoming webinars and viewed archive webinars. You can check out our CAN-DO MS Lifestyle Empowerment programs, including our CAN-DO program, Take Charge program, Jumpstart, and our Ask the CAN-DO Team program. You can share your CAN-DO promise and also learn ways to contribute to or get involved with CAN-DO MS. And just a few housekeeping things before we get started. Questions and comments will be addressed at the end of the presentation. We will answer as many questions as time allows. You can post your question by typing in the chat feature located on the left-hand side of your computer screen. To submit a question, type in the small box that says Chat with Presenters. And you can listen to the live webinar through your computer speakers rather than having to call in. This presentation is being recorded and will be archived on the CAN-DO MS website. All of our monthly webinars are archived on our website, and you can view them again at any time. You can also view the webinar schedule and register for upcoming webinars. Those of you who are attending live tonight will receive an email with copies of tonight's PowerPoint presentation. And please complete the evaluation at the end of the webinar. We value everyone's feedback. We have two wonderful speakers tonight, starting with Gail Hartley. Gail Hartley is a nurse practitioner specializing in the care of persons with multiple sclerosis at the Arcadia Neurology Center in Arcadia, California, and the MS Clinic at Casa Colina Center for Rehab in Pomona, California. She is involved in both clinical practice and research trials for MS. She is a consultant and speaker for CAN-DO MS programs. Additionally, she has been a contributor and served on editorial boards for several MS publications. She has been an invited speaker for numerous local and national patient and professional programs. We're excited to have her on board tonight. And then we have Terry DiLorenzo. She received her PhD in health psychology from Yeshiva University in 1999. She is a licensed psychologist in the state of New York and has been a faculty member in the psychology department at Stern College for Women for over 14 years. Terry authored the National Multiple Sclerosis Society's professional bulletin, Aging with MS, which was updated in 2011. Now, before we start tonight's presentation, we'd like to learn a little bit more about you. We already did our first poll with how old everybody was, and now we'll do our second poll. We just want to see, who's on the line tonight. Tell us who you are. A person living with MS, a support partner, healthcare professional. Let us know. Great, we got some good responses coming in. Okay, let's see what we got here. All right, a lot of you out there living with MS, some support partners and health professionals. Thank you guys all for being on. All right, Terry, take it away.
Welcome, everybody. Before we start the actual presentation, we just wanted to introduce the topic by describing some of the characteristics about older individuals living with MS. In terms of characteristics like gender and race, older individuals are similar to younger individuals, with the majority being women and being of white ethnicity. Older individuals are more likely to be living alone and to be retired. They are more likely to have a progressive form of MS and, of course, to have had MS for a longer time. On average, the older individual has had MS for approximately 20 years. Nonetheless, they are less likely than younger individuals to have a regular MS care provider.
Thank you,
Gail?
Terry. Thank you, Terry. This is Gail Hartley. I'm a nurse practitioner in Arcadia, California. It's my pleasure to be here this evening and speak with you. So when we're thinking about MS, we ask this question, how do we age? And we age in variable ways. We're all different. Some of us age very gracefully. Others have more challenges. And what are the influences around that? Well, first of all, genetics are involved. You know, we can look at our parents and family members and see what their aging was like, what their health was like, and that can give us some clues about what our future holds. But of course, a lot has to do with the lifestyle choices that we make, and this has an impact on our future health. So we talk about things like diet and exercise, but also how we think about those psychosocial issues about our future, how we plan for retirement, our finances, and any special needs we may have in the future. So when we think about aging, we also, I think one of my slides is out of order here. I'm so sorry. Older age is, of course, associated with more health conditions. So we see that as Rolling Stone gathers no moss, we do gather moss as we get older. And so we have an increased risk for disability and may need more assistance as we get older, whether we have MS or not. We're certainly concerned about our future in terms of those physical changes, but also we're concerned about our ability to remain independent. We like to think of ourselves as good advocates for ourselves and that we can do, but we certainly do have concerns about whether we'll be able to do that as we get older. And some of that is influenced by our financial resources and options, and there's a big question about what our life will be like in the future. And that's very difficult to answer. As I said, we do accumulate problems over the years. Aging is more than wrinkles. We see that there are changes in our cardiovascular health. We may have problems with rhythm disorders or high blood pressure. We can have more problems with our bones and joints and muscles like arthritis. We can have problems with osteoporosis. Our vision certainly changes and our hearing may become impaired. This isn't true for everyone, but it's certainly a potential. We sometimes have more problems with our digestive system. We see more bladder urgency and urinary tract problems as we age as well. And then we have to worry about our dental health. This is something that's often neglected, but very important to our health in general. And then our memory changes. Our ability to recall things quickly can change, and that can be influenced by many other conditions as well. So again, we see the same age-related changes in MS as we see in the general population. But the life expectancy for persons with MS is not significantly reduced. As a matter of fact, most MS patients will live well into their 70s. Somewhere between 10 and 25% of persons living with MS are 65 years or older now. Older persons with MS are more likely to have disability. However, there are some changes in that regard. We have better medical treatments and services for patients with MS, and that may improve the outlook as we move forward. If you recall, 20-some years ago was the first time we actually had a treatment for patients with MS, and so that has changed things much for the better. It also means that there's a continued need for access to medications, disease-modifying therapies, symptom management, and rehabilitative services like physical therapy, occupational therapy, and speech therapies. So those are all appropriate treatments for us as we get older. So what are the strategies for healthy aging? Some of these changes can make very big differences in our health over time. And even the smallest, simplest changes can make profound differences. So some of the things I'm going to talk about now are things you've heard before. They may seem very simple and basic, but honestly these are the hardest changes for people to make and maintain over a lifetime. So for example, when we talk about diet, we always want to improve our diet. Most of the patients that come in my office are very, very interested in diet management and whether that will have an impact on MS. Most of you may have heard that there are some diets that are recommended for multiple sclerosis, but there are so many that are recommended and there's not consistency over all of them. But I will say that a diet that's high in fresh fruits, vegetables, whole grains, lean sources of protein, and low dietary fat are recommendations that are consistent with the American Heart Association, sort of that Mediterranean diet, and that can help reduce cholesterol levels, reduces your risk for diabetes, helps you maintain a normal weight. It's also important to have adequate calcium and vitamin D. This is particularly important because this is a disease that affects women more often than men, and women tend to be at greater risk for osteoporosis, although it's true that men can have that as well. Women tend to avoid eating a lot of foods or drinking milk which contain calcium because of the calories. And so it's important to take a supplement of that if you do avoid those. High fat, high sodium foods, of course, should be avoided by Heart Association guidelines. And then limit alcohol. This is important for blood pressure control, avoiding diabetes, and also problems with substance abuse, in addition to its effect on balance and coordination. Control your portion sizes. This is probably one of the biggest factors in obesity in the United States today, because we tend to eat very large portions compared to what we actually need to maintain a normal weight. And then, of course, there's exercise. The American Heart Association recommends that we include physical exercise almost every day. And research has shown that there can be significant improvements in your quality of life, mood, and cognition when you're more physically active. It's important to find what works for you. Even persons who have disability have some ability to do some physical activity on a daily basis. And it's great if there's something that you can find to do that you actually enjoy. It's sometimes hard to keep the motivation. So if you have an exercise buddy or you have a group that you can join in, that is really ideal. And it helps you get out of the house and out of your own little isolation to be involved with a group. You have to balance that exercise with rest so that you don't become so fatigued that you can't do anything else during the day. It's always a delicate balance. And speaking of balance, we have to reduce your risk for falls. According to the Center for Disease Control, 1 out of 3 adults over the age of 65 falls every year, and most of the time it's not reported to their physician. The falls for people 65 and older are the leading cause of injury and hospitalization because of fractures and head injuries. And that makes it harder for you to get around and puts people at risk for not being able to live independently. So how do we improve that? Well, staying physically active helps to maintain muscle strength, which again helps to improve your balance. So physical therapy for balance can be essential, especially for persons with MS. So this is something that often my patients go back for physical therapy tune-ups, so to speak, on an annual basis. Utilizing assistive devices for walking safely is very important, especially when you're out in the community because you have uneven surfaces, there are often crowds around, and a cane can help you maintain a little bit of balance. Plus it gives a clue to people around you to be careful around you. In your home, keep traffic areas clear of items like loose rugs, coffee tables, electrical cords, anything like that, including your dog's bed that you could fall over when you're walking around. Don't walk in the dark. Always use night lights. Remember that you need 3 things for good vision, for good balance. You have to have vision, you have to have position sense with messages from your feet to your brain about where you are in space, and you need an intact vestibular system. So knocking out any one of those, especially the lights, causes balance to be significantly impaired. So have your eyes checked as well. And again, review medications because many of the medications we use for MS patients can cause some dizziness or more fatigue and create more challenges for you. We also have to consider sleep because sleep changes as we age. It takes longer for people to fall asleep. People often have more difficulty staying asleep or they wake up too early. Sleep disorders are very common. Obstructive sleep apnea is a common problem that we see, and restless leg syndrome may be a little more common in MS patients than in the general population as well. Persons with MS have sleep disturbances for other reasons besides those I've already mentioned. Pain and muscle spasms or spasticity, problems moving freely in bed, being unable to roll over easily, and problems with anxiety and depression can also affect sleep. The other thing is in this country, we have very poor sleep habits. People keep irregular sleep hours. We stay up watching television. We have television in the bedroom, which delays the onset of sleep. And sometimes people with MS spend more time sleeping during the day than, and when that happens, it disrupts your nighttime sleep as well. So there are some recommendations for successful sleep. First of all, I tell my patients to consider sleep as an activity. Sleep doesn't just happen. You must plan for it. You have to prepare yourself for sleep. Create that sleep ritual, whether it's turning down the lights, having a cup of tea or warm milk, something that tells your brain that now it's time to slow down and go to sleep. Go to bed at the same time every day, and getting up at the same time every day sets that internal clock that will keep you on schedule. If you're sleeping during the day, limit your nap to 1 hour. Set an alarm if you need to. Sleeping too long will disrupt your nighttime sleep. Pay attention to your environment. Create a place to sleep that's dark, quiet, and no television. When you are staring into a light source, whether it's your TV, whether it's your smartphone, whether it's your Kindle, that's light reflected into your eyes that actually stimulates your brain, so it makes it more difficult for you to sleep. If you can't fall back to sleep if you wake up, get out of bed, sit, read something very boring, not something engaging, something very quiet. Give yourself 20 minutes or so, and then going back to bed and trying again. Another issue for aging in MS is trying to distinguish what's an MS symptom from an age-related symptom. It can be difficult, and sometimes healthcare providers who don't know a lot about MS find find it uncomfortable to try and figure out. And often they'll say, oh, it's just your MS. But it may not be. Things change as we get older, and often those symptoms are very similar. But it's important for us to investigate each one of those, because some of these symptoms can be caused by other conditions. For example, weakness, fatigue, pain are things that many persons who are aging can experience, but they also may be symptoms of MS. But we have to see if there are other things that could be causing any of those. It's important also to keep your wellness checkups. So seeing your general health care provider at least on an annual basis is important, because we need to manage other chronic health conditions that can come along. We need to be aggressive about treating those, because they can affect your neurologic health as well and have impacts on your MS. So it's important to have those health screenings, breast exams, mammography, prostate exams, and colonoscopies as recommended. Again, your eye exams are important, and your dental health as well. It's important to stay on top of MS. So staying in touch with your MS team, your neurologist, your nurse, getting to see a physical therapy if things change with your mobility or speech or cognition. Very important to stay in touch so that we can manage those symptoms really optimally, so that you have a good quality of life. Disease-modifying therapies are important at any age, because we want to prevent relapses. We're trying to delay more disability. And things are changing at a rapid rate. We have new medications, several new medications in just the last couple of years, and there are more on the way. So it's a very exciting time for persons with MS, because we have new and better options for treatment. We also have to plan for our potential needs as we get older. We have to try to anticipate and think ahead what might be. What other conditions do we have to deal with? What is our health now? You have to consider your care partner's needs as well. Will your care partner be able to help you, or does that person have other health needs that may need to be addressed as well? You need to look at the larger social situation too. Are there other family members that are available to help you? Considering financial planning is very important. Identifying your resources. Of course, we're always concerned about our access to insurance and being able to maintain our medications. Some home modifications may be necessary if mobility changes. So for example, if you're living in a 2-story home, can you modify things so that you can live on the first floor, or does it make more sense to move to another place that's more mobility friendly? In-home care services may be an option for you, and some patients will decide that assisted living makes more sense, because more services are available for managing care. It's also important for us to think about end-of-life issues. These are very delicate and emotional topics to talk about with your loved ones, but it's very important that you discuss your wishes with family members and your support partners so that they know what you want. If there comes a time when we need to talk about life support, for example, or advance directives for health care or living will, these things should be in place not just when we get older, but actually even younger people should have these in place, because it makes things easier and more clear for families in the case that you can't make decisions for yourself. So designating who would have power of attorney for your health care or finances is an important piece of that. So we can't always predict the future, of course. Whether we have MS or not, aging is a process and part of being on the planet. It can be considered an adventure in many cases. And our goal, of course, is to live optimally. So be proactive in maintaining your general health, keeping in mind that you don't have to change everything in a day. Small changes every day can make a big difference in your future. Managing your MS disease and the symptoms that you face on a daily basis is an important part of keeping an optimal quality of life. We have to be adaptable to changes and anticipate changes as we get older as well. I think it's important to plan ahead because we don't have to worry so much if we have a plan in place. We maintain a hopeful, positive outlook as we get older and look forward to the future.
Okay. For the remainder of the presentation, I'm going to be talking about emotional well-being and strategies to deal with mental health problems and to promote emotional health. Okay, so first I'd just like to mention that until fairly recently we didn't know too much about emotional well-being or even physical well-being in older individuals living with MS because they had typically been excluded from a lot of the research focusing on people with MS. But this has been changing in the recent years, and there are actually now a number of research studies that focus specifically on older individuals with MS. In general, if we talk to older people living with MS themselves, they often will report that they feel that they're doing as well as or even sometimes better off than younger people with MS in the areas of overall quality of life, as well as general health. So here we're talking about health outside of MS. And also they report that they feel their mental health is better than their younger counterparts with MS. That said, many older individuals with MS do suffer from depression. The most recent research finds that approximately 17% of older individuals, and here I'm talking about people who are age 65 and older, may have depression at a given point in time. The people who seem to be most at risk for depression are those who have more impairment in mobility and also those who have cognitive deficits. But what's important to note here is that depression can often be very effectively treated with either medication, antidepressant medications, and or psychotherapy. That said, what we find is that older people living with MS who experience mental health problems are less likely to seek treatment. And that's actually a pattern that we see in the older cohort today in general, probably who tended to grow up in a time when seeking mental health treatment was less common and there was more stigma associated with it. So it is important for people who experience mental health problems to go ahead and try to seek treatment. And only about half of those people currently go on to do that. When we think about the fact that many older people with MS do seem to feel that they're doing as well as or better than younger individuals, one of the factors that we think might be related to this is the idea of social comparison. by the time we're older, we see that our peers' abilities and health may also be declining. So whereas someone with MS who's older has typically been living with some kind of disability for years, it's at this point when they become older that his or her peers are also developing medical conditions or physical impairments for the first time. So now people with MS may feel more similar to their peers than they had in the past. And sometimes that casts them, in the role of expert in terms of how to deal with health situations, and that may contribute to the fact that they perceive themselves to be doing better. Okay. Another factor that seems to be related to positive adjustment in older individuals is that they may become more willing to accept assistance or support from other people as they advance in age. Many older people are concerned about becoming a burden. However, they often will report that they're more willing to accept help from other people, and that the benefits of that tend to outweigh the concern about becoming a burden. And they receive such positive feedback from people who are willing to assist them that it makes them more likely to ask for that assistance. Another factor that may be related to adjustment in older people is that they seem to become more willing to use assistive devices with age. Not to say that it's easy necessarily the first time somebody uses an assistive device, and oftentimes people will say, I feel like I'm giving up or I'm giving in when they initially do that. But once they've used it for a short period of time and they recognize the benefits of using it, they continue to use it and possibly seek out other devices that will promote mobility. Okay, another strategy is that of pacing or planning activities. As people become older, they become more experienced, and they often can develop compensatory strategies that allow them to plan activities in a way that allows them to maximize what they can do. So rather than planning two big activities on consecutive days, to space them out and to pace themselves so that they can conserve energy and be able to do the things that they most want to get done. Prioritizing what's important in life is also another strategy that people report helps them to adjust to having an MS when they're older. And many people with MS and other kinds of medical conditions indicate that they changed their priorities. They've really thought about what's most important in life, and they've come to focus on the things that are more important, and that they've really developed an appreciation of kind of the simple things, so to speak, in life, like family or friends or, taking time to smell the flowers. Okay, giving back to the community, to other people, to the younger generation is important in enhancing quality of life and people's self-perception. Volunteering is very common in older people who are living with MS. Some of the things that they talk about being most helpful include spending time with the younger generation, imparting wisdom that they've acquired over the years, participating in support groups in which people can not only receive support and get advice and strategies and tips, but also can share their own tips and advice with other people in the group and give back in that way. Volunteering in any capacity with any kind of volunteer organization. And now with the number of online kinds of activities and programming, even people who have significant difficulty getting around are able to participate in these kinds of activities, and they report that they are very beneficial in terms of emotional well-being. But speaking of support groups, a recent survey of older people with MS that was trying to get a sense of what needs that they have that they're not able to meet with current services available was that of support groups. Many people indicated that there are not enough convenient support groups that address their particular concerns, so that the issues related to timing and location of the group are important, as they are for anybody, but also the fact that many of the groups focus on concerns that may be more relevant to younger people. So maybe gearing or tailoring such groups to the needs of older individuals would be necessary. And then in a discussion about older individuals with MS, it's important to also recognize some of the concerns related to the support partners, particularly when the support partners are spouses or friends or family members who are also older. Depression among support partners, particularly spouses, is common and may be at rates that are even higher than the rates of depression in the MS population itself. And the physical health of a support partner may also suffer. People who do provide a lot of care often will suffer from physical conditions at rates higher than other people. Okay, so some strategies for healthy aging that may be somewhat repetitive to what Gail said earlier include seeing an MS specialist. Remember, as I pointed out at the very beginning of the presentation, even though people who are older and have MS have had MS for a longer period of time, they are less likely to see somebody who specializes in that condition. It's important to be on the lookout for any symptoms of depression or any other mental health concerns, anxiety, frequent crying, sadness, or trouble sleeping, as Gail pointed out earlier. And here is another situation where it may be difficult to tease apart the effects of depression, aging, and MS. So when any of these symptoms become apparent, it would be important to mention them to your care provider to have them assessed and then appropriately treated. And as I said earlier, there are very effective treatments for mental health problems that are available, and those can be in the form of medication and psychotherapy. And certainly an MS specialist would be able to refer you to an appropriate mental health professional in order to get that treatment. A couple other strategies here include trying to accept offers of assistance from other people, to be open to trying different assistive devices, and then also to seek ways to give back to other people to promote emotional well-being. Okay. we're at the question portion.
Awesome. Well, thank you so much, Terry and Gail. We do have some great questions that have been coming in. One of the biggest questions that we got, and it was asked several different ways, was, and Gail, I think this would be directed to you, would be, does MS ever stop progressing as we age?
Well, that is a good question. And I can say that MS is a highly variable disease. I certainly have patients into their 60s, 70s that are still walking and traveling. And of course, I have other patients in the same age group and younger that have far more disability. We cannot predict how it's going to go. We do look at what the past history has been, whether someone has had very active disease, a very progressive course, or whether it has been slower. And we kind of try to guess what the future is, but we can't really predict it. So we always plan for the worst and hope for the best. In these cases, it's not the case that we would stop treatment necessarily for a person simply because they were getting older, for example. We still are very concerned about maintaining function as best we can and maintaining people's independence.
Thank you, Gail. I appreciate that. And then another question came in with, how do we deal with menopause and hormonal changes with MS and as we age?
That's an interesting question. There have been some studies recently looking at hormones and their effects on multiple sclerosis, and we're quite sure there are some effects, but we're not exactly sure that hormones themselves would be a treatment for multiple sclerosis. Sometimes women will notice a change in their MS around the time of menopause. Sometimes we see a little more progression, and it's not clear that that's because of the hormone changes or whether those women may have lived with the disease already for 15 or 20 years. So in any case, in our practice, we still treat with our disease modifying therapies, but we also ask women to see their gynecologist, and if there are if hormone replacement therapy is appropriate, then we let the gynecologist decide how that treatment will go. But it's still not clear exactly what role the hormones play in MS.
Thank you again. And then another question came in about, how do you know what causes forgetfulness? And on the same level, they talked about memory loss, same type of thing. How do you deal with that, and what causes it?
Terry, do you want to talk about that at all?
I'm sorry. Could you just repeat the question? I was reading one of the questions online that I wanted to respond to.
How do you know what causes forgetfulness as we age?
Okay, right. Well, it's difficult to determine exactly what the causes of forgetfulness, where they stem from, because forgetfulness can be a symptom of MS, it can be a symptom of normal aging, and it can be a symptom of depression. So talking to an MS care provider, which may include a mental health professional who specializes in MS, may help to tease some of that apart. And if there is any indication that the forgetfulness may in part or more than in part be due to depression, treating the depression can sometimes help to alleviate some of that forgetfulness. So the bottom line is to be assessed by somebody who's familiar with all of these issues.
Right. I would add one thing also, that sleep disturbances can contribute to some cognitive problems and mood problems. And we also see that in some patients with abnormal thyroid levels or certain vitamin deficiencies like B12 deficiencies can contribute to some memory changes as well.
Thank you both. And I know we touched on Alzheimer's earlier in your presentation, Gail, but we did have another question come in. Would a person with MS be more likely to have a stroke or Alzheimer's?
Well, Alzheimer's is a completely different entity than multiple sclerosis. We don't believe it's autoimmune. We believe there are other changes in the brain that are occurring, and it certainly presents very differently than it may start with a little forgetfulness, but generally there are other kinds of changes that occur as well. So it looks different than cognitive changes in MS. Stroke is an entirely different problem, and persons with MS are no more or less likely to have a stroke. That is more influenced by other kinds of health conditions in terms of cardiovascular health, hypertension, diabetes, for example.
Okay. And then there's also a question about balance. Is there a particular type of program that is best for improving balance or can help you to improve your balance? And on that same note, someone had asked, what is the third balance component again?
Okay, so the three things that you need for good balance are an intact vestibular system. That's your inner ear, has to be functioning. You have to have proprioception, which is the messages from your feet to your brain, and you have to have vision. Those are the three things you need for balance. It's a great question about what kind of therapy for balance. I think one of the things that's very important when we prescribe physical therapy for patients is for you as a consumer, as an MS patient who's going to physical therapy, try and find a physical therapist who knows something about MS. Because they will be able to help you more than someone who's used to rehabbing patients after knee surgery, for example. So for balance therapy, though, there are some new devices that the physical therapist can make very detailed assessments about where you're off on your center of gravity during your walking and also when you're standing, so they can make that very detailed assessment, and then they can target the therapies for that. So if you have a center that does something like that, ask specifically about balance therapy.
Thank you so much. And then, Terry, I have one for you. I know we had talked about depression earlier, but we had a person ask, they experienced depression as a symptom of an exacerbation. Sorry.
Mm-hmm.
Thank you. And what other options are there besides antidepressants to help with the depression? Normally used for like long-term care and stuff too.
Right. Well, the two main methods of treatment for depression are the antidepressant medications, which are commonly prescribed for depression both in people with and without MS. Those medications typically take between 2 and 4 weeks to start being effective. The other approach to treatment is psychotherapy. Psychotherapy may also take several weeks in order for that to be effective as well. However, a person who has regular contact with a therapist over the longer term would benefit at the time of an exacerbation from already having been in treatment. So I suppose the question, if I see it here, is what alternatives might there be other than using an antidepressant for the long term? The answer is there's really no quick fix to depression that, where depression might emerge quickly in the context of an exacerbation, right? The treatment of depression would take a little bit of time. But if somebody is indeed prone to experiencing depression, considering a more long-term approach to treatment might be one way to address it. If there's a concern about taking antidepressant medications for a continued period of time, perhaps maintaining an ongoing relationship with a psychotherapist would be beneficial in that regard, in that the relationship has already been established, an assessment has been made, treatment modalities that may be effective for a particular person could have already been identified and developed, and that might be useful to treat a new case of a recurrent depression.
Well, thank you so much, Terry, and I think that will conclude our question and answer session. So thank you so much to Gail and Terry for tonight's presentation, and a big thank you to all of you participants who joined us for tonight. And before I share the topic for next month's webinar, I'd like to share information on our new book released by CanDo MS titled The Guide to Lifestyle Empowerment. This book was co-authored by several of our program's consultants, and it was edited by Pat Kennedy, a registered nurse and nurse practitioner who has been working in the field of MS since 1987. To find reviews and purchase online, visit our website at www.mscando.org. More info on the book is listed under the Programs tab. The next monthly webinar is July 9th at the same time, 8 p.m. Eastern, and the topic is bladder and bowel issues, to pee or not to pee. The presenter that evening will be CanDo MS Programs Consultant Susan Collada, Urologist, MD. So please join us live from the convenience of your home or office at no charge to you. You can register for this webinar under Programs on our webinar tab at mscando.org. And for those participating live tonight, once the presentation has concluded, you will see a survey appear on your computer screen. Please take a moment to complete the survey and share your input. Your feedback helps us to continue to improve our webinars. You will also receive a copy of tonight's webinar slides by email. Thank you so much, and that concludes our webinar.